I wouldn't make a habit of that if I were you, Mr. Binns.
I'm sorry, sister. I didn't mean to frighten the girl. She's trying to make her laugh.
Apology accepted.
Good morning, Mr. Binns. How do you feel?
Not so bad.
Well, if this wound is satisfactory...
Oh. Something wrong, Doc?
I was hoping to send you back to discharge you. Any discharge here is from the wound.
We're worried that the wound's infected, Mr. Binns.
Oh, you're not going to keep me in, are you, Doc?
Just another day, I hope, Mr. Binns. Can you do a swab and start flu clocks, please?
Sure.
Leave me be. Her stroke would appear to have resolved.
She kept the whole ward up for most of the night. She's quite a handful.
You're telling me? Do we have an ECG, Liz?
This is from this morning.
She's flipped her T waves anteriorly. I reckon this lady's had a non-Q wave infarct. It would have been nice to know she'd had a heart attack before I started a wrestling match. What am I listening for?
Murmurs. She's had a heart attack and a stroke. She may well have endocarditis and a sent blood clot to the brain.
No murmurs. Keep listening to her heart. If a murmur develops, you treat for endocarditis first and ask questions later. Treat the pneumonia and rehydrate her slowly. Since we can presume a TIA, cancel the CT if one's been requested, and aspirinize her if there are no contraindications. Only CT if there's any lingering doubt about the diagnosis. Caroline, can you see if there are any beds on geriatrics coming up, please?
OK.
If you do an ECG, look at it. There'll be no shortage of people to look at it when you're in court. Andrew, you know the protocol for patients of this age. She should have been sent to geriatrics first thing this morning. Get this old crumbly off our ward.
Thank you, Claire. I've been doing an urgent echocardiogram. So, where have we got to?
Mr. Risley, diabetic ketoacidosis.
Good morning, sir.
Morning.
I'm Sarah Hudson, consultant physician.
How do you do?
Right. This patient's sugar is climbing. I thought we were supposed to keep it normal, not have it going up and down like a yo-yo.
Well, I tried asking Claire.
Dr. Hudson,
Yes, we will discuss this at a later time. So, stop the GIK, restart a driver. Act rapid 6 units an hour, hourly BMs, sliding scale.
OK.
It's just a little hiccup, so we'll get you right in no time. Yeah?
I have to find Eric.
Come on, Edith. Back to bed now. Come on.
Come on, Edith.
Come on.
Come on, Edith. I'm the nurse. Let's get you back into
Come on.
bed.
Come on.
You'll only hurt yourself, Edith.
What's going on now?
Mr. Channing.
I didn't hear last night there were 2 of you holding her down and one of you sticking a needle
Mr.
in.
Channing, I gave her a sedative myself because she was a danger both to herself and to other patients.
It's no way to treat a frightened old lady.
I know, I'm sorry.
I just want to know how she is.
Right, looks like she's had a transient ischemic attack. That's a kind of mini stroke that goes away again. There's also evidence of a heart attack and her kidney function is impaired. All these things together may be the reason why she's not been herself. You see, illnesses in the elderly may mimic senile dementia.
I don't want her suffering for no reason. No needles or drips.
Only what's necessary.
If you don't know, don't be afraid to ask.
Thanks, Patrick.
No, it's my job.
Kirsty, could you start by helping enroll Nurse Reese in the plaster room, please?
Kirsty.
Of course I want to. I'm a devotee of contemporary theatre, but I've got a tummy ache.
Oh, yes.
I might be better by tonight, though. We'll see, shall we? Bye, love.
You pillock. Patrick, I've got these tickets and, well, no use for them, for tomorrow. I thought they might make a nice treat for you and Mrs. Garden. For the opera?
Oh, well, it's difficult getting babysitters for the twins, you know.
Kirk and Dirk.
Opera's even more boring than plays. Fat birds singing in foreign. Sort of crap Nazarene to make Raj go and see.
I don't like Beethoven and that.
Beethoven didn't write any operas, stupid.
In fact, he did write one entitled Fidelio.
Oh, well, you're welcome to them, Cyril. Children, please.
Gotta be joking. It's Judas we came to see.
Mate, do you think I'd rather see a poxy play than join the lads for footy?
Then tell your girlfriend it's a question of priorities.
You're right. Priorities. Count me in.
My team.
good decision.
Ralph, if James and Scissors asked you to jump in a lake, would you do it?
No.
You would, wouldn't you?
No.
Are you chewing?
No.
Give it to me, please. Thank you.
I accept there's no love lost between you and Liz. What I cannot accept is when it affects patient care.
That's not my fault.
It is your fault that Liz is scared to ask your advice in case you bite her head off. It is your fault that when I asked you to accept responsibility for teaching her, you do so in a needlessly adversarial manner.
I believe in education through humiliation.
Don't be flippant. Do you not realise we work under a glass ceiling? A female consultant, a female registrar, a female house officer? Graham Turner and his old boy network cronies would cream their pinstriped suits if they knew what was going on. Stop being such a bitch.
I'm sorry if I've let you down, Dr. Hudson.
Claire, if you want to get where I have, there is that ceiling to break through. There are plenty of people waiting to find fault. Stop making it so bloody easy for them.
He's not coming, is he?
Just give him 5 more minutes. He's away to the theatre, isn't he? Ah. Claire. We were going to pick Raj. Turns out he's a girl after all.
You Regis, what do you get up to in there?
Edith, come on, back to bed. This way. I'm so sorry. She'll be going to the geriatric ward tomorrow.
You kept that a secret pretty well.
It was a secret.
You know.
No.
You and Scissors Smedley.
What about me and Scissors?
Was that a clanger I heard dropping? Better go and pick it up.
How's that wound infection today, Mr. Binns?
Another day? I'm afraid so.
Well, your chest is clearing, Edith. I think you're getting better.
Better?
Antibiotics to oral. Continue oral rehydration. Can we start mobilising on the cardiac rehab protocol, please?
Can it wait till she goes to geriatrics? They've fewer acutely ill patients to be busy with.
I'd rather give her a chance here first.
But you know what happened last night. Look, she's a danger to other patients.
I don't want this to become something personal between you and me.
Dr. Collin, outside call. Your wife, no doubt.
Mr. Channing?
What are these from?
It's where the drips have been.
And where she's been held down.
I'm afraid sometimes your mother does become confused, but she's getting better.
I've been looking at nursing homes near us, so my wife and I can visit more. I want my mother to be somewhere where people can look after her properly, instead of tormented with tests and injections.
Mr. Channing, we're still doing all we can for your mother.
How about that, Mother? You'd like that, wouldn't you?